Hi everyone. Well, we knew that the start of this year was going to be difficult, and we were right. The Omicron variant of COVID and the ongoing operational pressures have been extremely challenging, and you'll know that we've spent much of the start of this year in an internal capacity incident. Nevertheless, we've all been pulling together and working in different ways, and we've managed to maintain essential services for our patients, and we've supported each other so that we could be able to keep going. I've been so impressed by the dedication of all UHD staff, and as I go around our various sites, I constantly see people living out their values and being one team together. It's been really humbling to see how well people have worked together to keep services running, and I can't thank all colleagues enough for your innovation, dedication and compassion. Frontline staff working on our wards and all those involved with discharge planning know all too well how pressurised things are too within the social care sector. This is a sector which has also experienced significant challenges throughout the COVID pandemic, and of course it all affects our services too. Creating more capacity within the community is very much a priority for the Dorset system, and we're working hard with our partners on a range of initiatives that will help us to improve flow throughout our hospitals. And this isn't just pie in the sky. The past few weeks have seen the opening of our new care home facility at the Village Hotel opposite the Royal Bournemouth Hospital, and this has really helped us during this incredibly difficult time. This is just one of a range of new initiatives that have recently been introduced to help improve flow throughout our trust. Another innovation is our work at the outpatient assessment clinic at Beales department store. We've converted the top floor into a clinical area to help us see more patients and begin to tackle the outpatient backlog. And this has included breast screening services, dermatology, orthopaedic and ophthalmology clinics. The space is really flexible, and so before Christmas we were able to use it when our amazing teams vaccinated over 2,000 members of the public against COVID as part of the national vaccine drive. So whilst there are lots of challenges and problems to be solved, everywhere that I go I see people finding solutions to these challenges, working in new and different ways to provide even better care. I was really proud to welcome Amanda Pritchard, the Chief Executive of NHS England, to see the outpatient assessment clinic for herself. She was hugely impressed by the way we're working to reduce long waiting lists caused by the pandemic, and she's mentioned us several times on her national calls, citing us as a great example of innovative practice as we go about improving services for our patients. Now, as many of you will be aware, I'm preparing to retire from the NHS and I'll be leaving the Trust at the end of this financial year. Whilst I am of course looking forward to the next stage of my life, at the same time it feels quite hard to step away with so much going on. Of course, the NHS is constantly changing in response to new challenges and new opportunities, and I recognise, like many others before me, that it's not possible just to finish everything before I go. And it's this that makes working for the NHS so exciting and so rewarding. We'll always be changing and developing and improving as we seek to do the very best for our patients. But you know, at times all this change and challenge can be a bit overwhelming, and I know that today many of you are struggling in the face of increasing demand and staff shortages. I know that at the moment space is limited on some of our sites, so you're not always able to deliver care in the most ideal environment. The good news within UHD is that we really do have plans in place to address these things, and as such there's a very positive future ahead of us. More and more health systems are adopting the same model as we are, working to separate emergency and planned care, which we know allows us to provide safer, better care for our patients. And our recent merger means that in coming out of the pandemic, we have a sustainable organisation with a great platform to build on. All services go through difficult times when staff feel under great pressure and wonder if there will be a light at the end of the tunnel. And I know that some colleagues within our cancer services have felt a bit like this in the past. This is a service that's been under immense pressure for some time now, but particularly with the onset of the COVID pandemic. And the team has worked so hard to maintain urgent cancer treatments, often under very difficult circumstances. There's such a wide range of roles involved in fighting cancer, from our healthcare scientists, radiotherapy teams, medical physics staff, and of course our nurses and consultants. At times, different parts of the service have been really short-staffed, missing key specialist skills from within the team. Added to this, some of the equipment's been very old. Our Linacs, those machines that provide the radiotherapy treatments, were previously the very oldest in the country. A few years ago, our oldest Linac was 16 years old and the youngest was 12. These machines would often break down, which meant that patients had to be cancelled and rescheduled, which in turn meant staff having to come in out of hours and over the weekends in order to catch up. There have been many issues to manage. How wonderful, therefore, to visit the team this month and to see how much has improved. There's still lots to be done, but things are definitely going in the right direction. There's been significant investment in equipment. Our oldest Linac now is just a baby, around 3 years old. That's the oldest one. And there's been significant investment in the staff, who of course make all the difference. It was great to see so many new staff in post and a team that's feeling much more confident about delivering what's asked of them. As chair of the Dorset Cancer Partnership, I know how much our services across Dorset mean for patients. They're really valued, and I couldn't be more proud of the cancer team. We all need to be encouraged to keep going in difficult times, and it's so important to remember that there really is a light at the end of the tunnel. Things will get better over time, and within UHD we have a really positive future. I know things have been hard over the last 2 years, and of course since the start of this year, and I know we still have much to do before we can fully realise our vision. But you know, we've embarked on a really important journey that will bring about big improvements in services and improved outcomes for local people. And I couldn't be more proud of the UHD team. Thank you so much for all you've done for patients and for each other throughout the pandemic, and for all you continue to do every day going forwards. Thank you.